Hey folks, welcome to another edition of the Healthy Way right here on Love 101 FM, the family station. Today we're talking about depression in pregnancy. Now, if you're pregnant, chances are you've heard about postpartum depression. But did you know that many women also experience depression during pregnancy? Pregnancy can be a time of joy and a time of stress. The research suggests that about 7% of pregnant women experience uh, depression during pregnancy. The rates might be higher in low and middle class income countries. Depression, a mood disorder that causes a persistent feeling of sadness, a loss of interest, the most common mood disorder in the general population. Well, it is, right? Now, the conditions occurs twice as often in women as in men, and the initial onset of depression peaks during a woman's reproductive years. It's quite heavy, right? So we're talking about depression in pregnancy today. This morning I have this superstar, Dr. Leo Walker, obstetrician and gynecologist from the Westminster Medical Center. Hey, my brother, how are you?
I'm on quite an introduction.
I know, you're in the papers this morning.
Thank you.
Yes, so where do we start? Are hormonal changes in pregnancy to be blamed for depression, Dr. Walker?
But I mean, from the beginning, as you rightly said, pregnancy is usually associated or usually is supposed to be a joyous time in a family's life, particularly in a woman's life.
Mm-hmm.
A lot of people don't consider, however, that there's some significant physical, emotional, as well as mental changes which can occur during pregnancy.
Mm-hmm.
Now, whereas hormones may have, some implication in those changes,
Yeah.
it's just like depression outside of pregnancy is not well understood in terms of, what triggers depression. So similar to the non-pregnant patient, pregnant patients, although hormones may be implicated, the underlying cause is generally not well known. We do, however, know that certain risk factors exist.
Yeah.
And these risk factors are similar again as in the non-pregnant patients. So patients with a prior history of depression, meaning patients who had a depressive episode outside of pregnancy, patients with a strong family history of depression because there is this genetic predisposition to pregnant to depression. Patients with of lower socioeconomic status, if it was an unwanted or unplanned pregnancy, patients who experience intimate partner violence at increased risk of developing depression. For social support, so patients who feel like they're going through the pregnancy, all alone essentially. As well as, patients who are especially in high stress situations. So life stressors, adverse life events, patients who have other illnesses, those who are diabetic, hypertensive, those patients are the ones who are more likely to be depressed in the pregnancy.
Right. Well, let's focus a little on stress of pregnancy and the body. Walk us through.
So, I mean, definitely one of the things which a lot of people will need personal experience or experience secondhand is that during pregnancy there's a lot of physical or body changes which occur.
Right.
So a lot of patients, may have a sense of body image dissatisfaction because of all these changes occur during pregnancy. Some patients experience increased acne. Of course, the weight gain which occurs during pregnancy, some of the facial features may change. The skin pigmentation may actually darken during pregnancy, but it may darken an uneven pattern. So you find around the maxilla, the cheeks, the nose, the abdomen becomes very darkened. But this is something which is physiological as a result of some of the hormones that are produced in pregnancy. So from a very basic point of view, these, personal body image dissatisfaction which can occur have a significant effect on a woman's self-image and confidence. It goes without saying, though, that these things can actually also affect the male partner. What they found in studies is that women who are depressed in pregnancy, when they look at the partners, these partners also have an increased incidence in depression. They do have an aspect called paternal depression, which can occur and increases in settings of, female partner being depressed.
Right. And then there's also an effect on the offspring.
Of course, of course. So again, numerous studies have looked at this, and
Mhm.
it has shown that in women who are depressed, there is certain cognitive impairment in the offspring, which can occur simply as a result of the woman being depressed.
Right.
We also have an increased risk of miscarriage, increased risk of preterm birth,
Mhm.
increased risk of operative deliveries, and of course, an increased risk now of being depressed after delivery. So that is where the postpartum depression will come
Mhm. Now, you made mention of body image and the way she views her body. Walk us through before and after pregnancy. Yeah.
in. Well, certainly, a lot of these body changes which occur are actually reversible. So many
Oh.
of them will revert back to your pre-pregnancy state. But you do have occasions where this is something which persists
Mhm.
even beyond the pregnancy. Again, from a very basic and superficial point of view,
Mhm.
simple things like the foot size may change during pregnancy
Mhm.
because of the increased swelling, the increased laxity of the ligaments.
Right.
Certain women's foot size may increase by around, one and a half
Mhm.
during pregnancy. So those nice shoes that she likes to wear, those, nice sandals that she likes to put on, may not fit as well during the pregnancy or even after the pregnancy.
Mhm.
Certain simple things because of the enlarged uterus. What tends to happen is the abdominal muscles become a little bit lax.
Mhm.
So the abdomen doesn't look as firm and as tight in the postpartum period. Whereas on occasion there's simple, physiotherapy which can correct that. A lot of women are dissatisfied with the overall impression of their body, particularly right in the core. So
Mhm.
that may be a central aspect of this body dissatisfaction, which can occur and which can persist even beyond the delivery.
Right. And then people are so unkind because they'll state the obvious, and it causes some mental challenges, disorder. And
Definitely.
yeah, what are some of the things that you would say to sort of guide them through the process of depression?
So I think insight is always important.
Mm-hmm.
So it's always important to one guide a woman through the expected changes which she can expect during pregnancy. Having had some expectation or in knowing what to expect,
Mm-hmm.
it kind of makes the transition a little bit easier.
Right,
If
right,
if it's well, doc said that this can happen, so when it does happen, it's almost something that's expected and it doesn't come as a usual shock.
right.
So that is very important for women to have insight and these are things which are normal.
Mm-hmm.
These are things which happen throughout the pregnancy, and these are things which,
Right.
for the most part, are likely to revert to the pre-pregnancy state.
Mm-hmm.
For the other things, you have to explain to women that listen, even if it doesn't revert automatically, there's definitely ways to approach them. There's ways to manage them. There's ways to treat them. Particularly when we're talking about separation of those core muscles, muscles, what we call the rectus muscles.
Mm-hmm.
Physiotherapy is an important aspect in terms of addressing those core issues and has been found to be very successful in addressing these things almost 100%.
Mm-hmm.
It's also important for us as physicians to recognize patients who may be developing or becoming depressed during pregnancy.
Right.
Addressing simple questions, asking simple questions about how they feel, what's their mood like, are they still enjoying the things that they used to enjoy? Do they
Mm-hmm.
feel guilty? Do they feel as if they're a bit worthless, have difficulties with concentration?
Right.
Those simple questions are things that you can ask pregnant women as a basically as a screen to see if there may be some elements of depression creeping.
Mm-hmm.
It's important to remember that a lot of the other things like appetite,
Right.
sleeping pattern, these are things which aren't very sensitive in pregnancy
Mm-hmm.
because the pregnancy itself can affect those things. So as for the non-pregnant patient, changes in the sleep pattern, changes in their food intake pattern may have some implication or indication of depression. In pregnancy, these are essentially normal pregnancy changes. We have to stick to more of the mood aspect
Right.
when we're doing that screen.
Right. Quite important. Well, yeah, I know women go through a whole lot to deliver a safe and a
Definitely.
healthy baby. And so, whatever we can do to sort of help the process, uh, we should sort of help them out.
Absolutely.
Yeah,
Absolutely.
so true.
And that's where the social support comes in, not just from the father,
Yeah.
but family members, friends. So it's
Mhm.
important to remember that, these women are going through a lot.
Right. And we have to be a little kind, we can't be too mean.
Definitely,
Yeah.
definitely.
And, offer a little support. Great. Well, I think we can leave it there this morning. Can we?
Absolutely. I think it's important to mention, though, that especially in developing countries,
Mhm.
depression can be significantly high in terms of the incidence, almost as high as 20%.
Mhm.
It's often something which is overlooked, kind of brushed to the side, but mental health is an important aspect in the management and care of women, not just pregnant women, but all women. And
Mhm.
it's something that we should pay special attention to because it often goes under diagnosed.
Mhm. Really important. How can we find you again, my friend?
So, of course, I'm at the Westminster Medical Center. That's 1A Westminster Road. I'm also known as Oxford Medical Center on Tuesdays. Um, you can find me on Instagram at Dr. Leo Walker, or you can contact me via telephone at 876-372-3790.
Thank you so much. And grab a copy of today's Observer, and you'll see Dr. Walker.
Absolutely. Absolutely. Absolutely.
Quite an interesting story. Yeah, he's
Thank
making a
you. Thank you.
difference.
Thank you.
All the
Thank you.
best. Catch you.
Yeah, and thank you.
Very well. That's for brethren Dr. Leo Walker. Yeah, obstetrician and gynecologist from the Westminster Medical Center. Yeah, he's in today's Observer. Have a copy of it, no? Yeah, and catch up with my friend. Yeah, our discussion today, depression in pregnancy. October is Mental Health Awareness Month, and so we are continuing the conversation around mental health. It's quite important, and we do have a part to play, you know, in keeping our brothers and our sisters going. It's really, really hard. And so, whatever we can do to make life a little easier for somebody, yeah, let's do it. Come back tomorrow now for another interesting feature right here on the family station Love 101, The Healthy Way. Please stay with us.